So we've looked at the PGD document in detail. So just to recap, who can use the PGD? Only fully competent, qualified and trained healthcare professionals can use it. They've got to be trained to operate within the PGD, and this session gives you the introduction that you need to start using them. You also need to be familiar with the individual medication, like you would be if you're administering it anyway, the SPC and the BNF, etc. You need to be able to know where you can access those and where to find the relevant information. You need to be able to evaluate symptoms and diagnosis. Now this causes a little bit of confusion sometimes. So if you're using a PGD, for example, for paracetamol, somebody's got a headache, so mild pain or moderate pain for abdominal discomfort, for example. As a PGD user, what you're not doing is you don't have to diagnose the cause of the headache or the cause of the abdominal pain. What you're diagnosing and evaluating is, does the pain meet the criteria of the PGD? Is the patient suitable to receive it for the pain? So you're assessing the pain. It is different if you're using a PGD for, say, an antibiotic, then you do need to be able to evaluate the patient and diagnose that they've got the relevant infection. And you need to be able to sort of refer if necessary, okay? So you need to be able to select the patient, and if you find it's not suitable for a PGD, obviously you would refer it on to a prescriber. And then really importantly, you have to be able to, you're signing to say that you'll be able to monitor the patient. So managing adverse effects, you have to be able to recognise someone who's having an allergic reaction. And relevant training for anaphylaxis can be found via the academy. So if you're unsure, then you need to go up to the academy and book yourself onto the relevant training. You need to be aware of all the interactions with other medications, etc. If you give them too much, if they're contraindicated, and if they've got any other sort of health things going on, just exactly the same as you would if you're actually going to be administering under a normal prescription. So training for individual PGDs, well, this is the first part of your training, listening to this session. And then you need training for the specific PGD, which needs to be organised by your relevant manager. So if you are a stoma care nurse, for example, then you would have your relevant specialist training for the use of your PGD. This training is the background to PGDs, and you know who can use them, and etc., and the audits and things like that. If you are a practitioner working in the emergency department and you're diagnosing infections and ear problems, you know, all manner of things, then you have to have the appropriate training for the appropriate PGD that you're using. But that is up to you as an individual and your individual manager and your individual departments. So the next thing you need to do after you've listened to this assessment is go online and do the PGD online assessment, because that basically checks your competence, that you understand what using a PGD actually means. So the PGD online assessment can be found on the YDH intranet, under Teams, under P, and under patient group directions. You'll then see this as the home page, and you've got some large buttons there, and the arrow is pointing to the PGD assessment. So you need to click that button, and then it will bring you onto some text, and then at the bottom of the text it will say complete PGD assessment. If you then click that button, it will then take you to a screen where you have to fill in your manager's information. Now, most of the time I want you to put your manager in, okay? So whoever has authorised you to use this PGD, because they will then be sent an email with your assessment. If you're using a PGD for flu vaccinations, then you need to put myself, Julie Reeve, R-E-E-V-E, in as your manager, because the assessments will then come to me. So once you have completed that, the assessment is then sent to your manager or myself. We will then check that you've got your answers correct, and then we will then mark it as either pass or fail. If you need to redo your PGD assessment, we will email you, and you just go back through the process, read that text again, maybe listen to this session again, complete the 5 or 6 questions, and then again put your manager's details in, and then they receive an email, and like I say, they will mark it. Going back to the home page again on the PGD, you'll then see another button that says list of current PGDs. So if you hit that button, you'll then see a list of departments, and if you click on your department, you'll see all the PGDs that are registered under your department. So if you're unsure about criteria, etc., you can always double check before you actually use it for a patient. And then if you use the home page, it will always take you back to the home page. If you've got any questions about any of this training or anything we've covered in the session today, then you can give me a call or drop me an email. So it's Julie Reeve on 5392 on the normal hospital email.